I don't know whether I need the microphone. Yes, it's probably better like that. I almost feel that Justin has done my bit for me, because he's talked about nutrition, which is obviously something which is very dear to the heart of WFP, the World Food Programme. So when I was thinking about what we were going to talk about tonight, are the MDGs a mission impossible? I thought, well, with only 5 years to go until 2015, and with progress towards reaching the 8 MDGs, variously described as uneven, too slow, and clearly threatened by the 3 Fs, food, fuel, and financial crisis, it would be all too easy to say these goals are a mission impossible. But as some of you may know, the World Food Programme is what might be described as one of the UN's can-do agencies. And I'd like to tell you about some of what we've been doing in the last 10 years since those MDGs were announced, since the world set itself these goals. For those who are unfamiliar with us, the World Food Programme is the food assistance arm of the United Nations system, reaching nearly 100 million people a year in over 70 countries. Through targeted interventions, WFP uses food assistance as part of a coordinated relief mechanism, with the support of over 2,400 partners globally, of which World Vision is very prominent, to reach vulnerable groups during emergencies and periods of recovery, strengthen livelihoods, and build national capacities to safeguard against hunger. As you're aware, the first MDG is to halve hunger and poverty. The two are, of course, interlinked, and I think everyone would agree that hunger undermines all the other MDGs. Unfortunately, the historic rise this year of the world's hungry to more than 1 billion people means that goal is all the more challenging. 1 out of every 6 people on Earth will wake up tomorrow not sure if they can find enough to eat. Food security is non-negotiable. If neglected, we face not simply failing to meet MDG 1, but catastrophe. 1 out of every 6 people on this planet is chronically hungry. I think this moves food security from being just a humanitarian concern to one that affects the peace and stability of the world. We know that if people do not have food, one of 3 things happen. They migrate, they revolt, or they die. Addressing hunger and undernutrition is fundamental if the world is going to reach the other MDGs. So it is vitally important that we prioritize our work to alleviate hunger, undernutrition over the next 5 years and beyond. Hunger and undernutrition have a devastating impact on economic development, health, and education. If initiatives aimed at addressing hunger and undernutrition are ignored, this will jeopardize the other MDGs. And I'll just run through them, including poverty, which is 1, education 2, gender 3, child mortality 4, maternal mortality 5, and health 6. Quite simply, if people are hungry, the goals cannot be achieved. A recent study by WFP and the UN Economic Commission for Latin America and the Caribbean, called The Cost of Hunger, estimated that hunger and undernutrition account for the loss of as much as 11% of GDP in some countries. Equally, countries experiencing conflict, emerging from conflict, or susceptible to natural disasters generally have the world's highest percentage of undernourished people. So it is critical that these fragile states, as they're known, are a central focus of MDG work. But there is hope. One of the most important lessons of the last 10 to 20 years is that reducing hunger and undernutrition is possible. The world was making good progress. From 1969 to 2004, we cut the proportion of hungry in half. The absolute numbers grew, but the proportion was cut in half. The world was producing more food than ever before and at a lower price. We have the knowledge and the tools to reduce hunger. For the World Food Programme, working to end extreme hunger and poverty, this is about the logistics of providing food assistance, living and working effectively in some of the most remote and dangerous places in the world, and designing programs that meet the needs of vulnerable people in rapidly changing environments. Some of the cost-effective interventions that work and reduce hunger and undernutrition, which WFP is doing now, center on delivering the right food at the right time to the right people. And I think this will chime in with our development secretary, who says he wants more bang for the taxpayer's buck. In other words, he wants to make everything much more responsible, with results. Complementary and supplementary nutritious foods for mothers and children and other vulnerable groups. Now, rather than focusing on the caloric content of generalized food rations, WFP are now designing programs for specific needs of young mothers and children. We also concentrate on school meals, and this is something that the DFID do not like, but never mind that, we'll go into it later perhaps. Last year, WFP supported 21 million children, at least half of them girls, who were able to concentrate and learn. It meant that they came to school. Their parents, who might have been wanting to keep them at home in order to look after their siblings or perhaps look after the chickens or the goats or whatever, actually sent them to school. Why? Because they knew their WFP would feed them. So maybe that was the only meal they got in the whole day. Nevertheless, they learnt because they were able to concentrate on their lessons. And that surely is one way out of the poverty trap. Food fortification and micronutrient supplements are also very important to WFP. We've become very innovative in thinking exactly what we put into those rations now. And with the technology that we now have, we can actually have what are called sprinkles put on top of a porridge or something, rather like our own cereals, which are absolutely power-packed with nutrients, which help children like Queen to grow up healthy and strong. Last year, WFP doubled the number of young children receiving nutritionally enhanced foods compared with 2008. And we increased by nearly 8-fold the number of under-2s receiving new products. This all has a cost to it, but we'll go into that later. Food for Work or Cash for Work programs, WFP helped 20 million people. Food, cash or voucher transfers, for example in Burkina Faso, as well as texts sent to Iraqi refugees in Syria, are just other examples of these innovative programs. WFP is no longer just about a bag of maize. So nutrition is absolutely critical. We know that even a few months of inadequate nutrition for a child during the critical window from conception to 2 years old can cause lasting damage, permanently impairing physical and cognitive development, the ability to fight disease, learn in school, and become a productive adult. Now, this is something to remember, that if you don't get in during those 1,000 days, I think it is, it's irreversible. So actually, what are we doing? We should absolutely be concentrating on the mothers, the young mothers, in order to give birth to healthy birth weight children, and then those children up to the age of 2. All this has, of course, long-term consequences for the community, potentially compromising an entire generation. WFP's approach to tackling child undernutrition emphasizes prevention, especially for those under 2s. And of course, women and girls are vital. Women are the first and fastest solution to reducing hunger and poverty. Women sow, reap, harvest, and cook most of the food. We know that in Africa, for instance, they make up about 80% of the farmers. And when they're given responsibility for household accounts, they tend to spend that income on health, improved nutrition, and education in their families. When it comes to accessing and using food, women are key. That's actually what made me attracted to join the World Food Programme, because the then executive director, Catherine Bettini, was responsible for this fairly novel approach at the time of saying, we are going to give the women the food. We're not going to give it to the men, we're going to give it to the women. We're going to empower the women. Undernutrition in women, often one of the outcomes of gender inequality, undermines their health and that of their children, limiting their full potential in education and employment, and often leading to premature death. We know that the new face of hunger is one driven not only by poverty, insecurity, discrimination, or local crop failure and natural disasters, but also by global economic factors. And here's that F. 1 year on, we see the fault lines in access to food from the village level up to the national, regional, and global levels, and the long-term drivers of volatility in supply and price remain in place. Coupled with the growing numbers of chronically hungry, the strain on resources from donors, the call from member states, justly so, for a bigger bang for taxpayer money, and the challenges of working in conflict-prone areas, we have our work cut out for us. But I'd like to end with a few positive thoughts. Given all the turmoil of recent years and a shrinking humanitarian space, it will be difficult to meet the first MDG by 2015, but we do know that rapid progress can be made, as the cases of Brazil, Ethiopia, Mauritania, and Vietnam have shown. Despite the challenging global picture, many countries are on track to reach the first goal. With a strong commitment at the national and international level and concrete implementation of effective strategies, many countries can reach the hunger MDG. The recent period of high food prices, to which we are apparently returning according to FAO, has led to an increased focus on food security and nutrition. Crises can sometimes create opportunity. Now is the time to act. Thank you.
Thank you.